Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Haley Kerstetter, digital editor at thehorse.com. Degenerative joint disease, or osteoarthritis, in horses is a common but complicated condition. While there is no cure for osteoarthritis, working with your veterinarian to correctly diagnose it, slow its progression, and manage existing joint disease can help maintain your horse's soundness in the long term. This event is sponsored by American Regent Animal Health. To answer your questions, we are joined by two expert panelists, Dr. Katie Ellis of the University of Georgia and Dr. Helen Mansfield with American Regent Animal Health. Welcome to both of you.
Thank you.
Thank you.
Dr. Ellis, can you tell us a little bit about your background?
Yeah, absolutely. First, thank you all for having me. I'm really excited to be part of this webinar. So I'm an equine sports medicine and rehabilitation clinician, and I'm actually part of UGA's field services team. So I travel to barns and I get to work on equine athletes of all disciplines and levels. And what I'm really interested in is equine rehabilitation and musculoskeletal imaging within my specialty. I do have one horse. His name is Leroy, but I also right now have two very young children. So Leroy is pseudo-retired for the last few years. He does not seem to be complaining about that, however.
Awesome, thank you. And Dr. Mansfield, can you tell us a little bit about your background?
Sure. Well, I was born and raised in Charleston, South Carolina, where I was involved in my local pony club, hunter and jumper shows, as well as eventing. I decided I was going to be an equine vet when I was 14 years old after I got to see my horse's colic surgery. Then I went on to the University of Georgia for my undergraduate degree and Tuskegee University for vet school. After vet school, I completed two internships, one in general medicine and surgery and one in advanced reproduction. Then for almost 15 years, I was in equine private practice all over the East Coast, working on every type of horse from backyard pleasure horses to Amish work horses to Olympic level show horses. I even spent a couple months in Germany working on some sport horses. Along my travels, I became certified in equine acupuncture and veterinary medical manipulation. And about a year and a half ago, I started working as a professional services veterinarian at American Regent Animal Health. Where here I provide education for veterinarians and horse owners nationwide, work on educational programs, as well as some other modes of educating practitioners, as well as future practitioners.
Thank you. Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions that were submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. So Dr. Ellis, our first question is for you from Jennifer in New Jersey, who wants to know what degenerative joint disease or osteoarthritis means. What happens to the joint during this process?
Yeah, so degenerative joint disease is also known as DJD, osteoarthritis, OA. They're all terms that kind of mean the same thing, but they really cover a really wide spectrum of disease process within the joint. So we usually think about an early OA, the joint gets inflamed, and that the joint's response when it gets inflamed is to produce extra fluid within the joint. We usually refer to that as effusion or synovitis. This often happens in athletic horses, and it's just due to wear and tear on the joint during exercise. If that inflammation gets worse, or if it's left untreated for long periods of times, what can happen is it can progress to damage that cartilage within the joint and even can eventually affect the underlying bone. And once that inflammation has been around for a while, the body actually responds by trying to stabilize the joint by producing extra bone. And so we'll see that on radiographs as kind of osteophytes, or what people will sometimes call bone spurs on those radiographs. We can also, though, have OA develop following a single traumatic event. So there could be a single injury to the joint that can also damage the cartilage, the underlying bone, as well as some of the soft tissues within the joint, and that can result in OA as well over time.
Dr. Mansfield, Brian in Ohio asks what signs horse owners might see in their horses that could indicate the development of joint disease.
Well, some of the early clinical signs of joint disease can include things like intermittent lameness, stiffness, reluctance to work. even subtle changes in gait, or even just the way they stand. I've even had some horses that just kind of get a little grumpier when they're asked to do their daily tasks. A lot of it also depends on the horse. Our more stoic horses don't often show signs of joint disease until later. And this is where we as veterinarians really rely on our owners to watch out for a lot of these small, subtle changes, because no one really knows your horse better than you do.
Very true. Dr. Ellis, Heather in New Zealand wants to know, at what point should owners put a sport horse on a supplement to support their joint health?
Yeah, this is kind of a tricky one. I think supplements in general are really tricky because there are just a ton of products out there, and not all products are created equal. To some degree, I think you get what you pay for. I think supplements are probably better used for more prevention rather than treatment, especially if your horse has more advanced OA, or if they're in the early stages of OA and have just mild joint inflammation. I do typically recommend the injectable joint support medications over oral supplements. There are some decent oral supplements out there, but the research really supports more of those injectable drugs. And then we also know that the horse is actually getting all the medication rather than spitting it all out on your barn floor.
Dr. Mansfield, Shay in British Columbia, says her horse was recently diagnosed with OA in his carpus. What are common treatment options for this, and should she expect this disease to rapidly progress?
Thanks for that question, Shay. We're living in a pretty cool age of veterinary medicine right now. There are so many more treatment options available to us these days that we didn't have, say, 10, 20 years ago. We now have a lot of intra-articular therapies out there like corticosteroids, hyaluronic acid, polyacrylamide gels, and even lots of different orthobiologic options. Then there's systemic therapies like polysulfated glycosaminoglycan or Adequan, which can help decrease inflammation, increase joint fluid, help heal articular cartilage, and slow down that progression of the disease. Also, we have those complementary modalities out there like shockwave, laser, acupuncture, chiropractic. The list just goes on and on. Your specific treatment plan is probably going to depend on the severity of the arthritis and that degree of lameness, because there's no one size fits all for OA. It's going to take a combination of therapies, or what we call a multimodal approach. Working closely with your veterinarian and figuring out what works best for your horse is going to be key. And that progression is going to be different in every horse. Getting regular soundness exams and some updated radiographs will probably help you assess further on how fast things are progressing. But like any other chronic disease, treating earlier usually has a more positive outcome.
Dr. Ellis, Christine says her farrier noticed that her senior horse's joints pop when he manipulates the limbs, but they haven't noticed any other signs of joint pain or lameness. Could this be an early sign of joint disease?
At least to my knowledge, popping joints is not a typical sign of OA, especially if the horse doesn't have any other signs, a lot of which Dr. Mansfield mentioned, stiffness, lameness, those type of issues, or show discomfort when it occurs. So it wouldn't be of clinical concern to me. Certainly, I've worked on a lot of horses whose joints kind of do make that popping sound, but the horse doesn't seem bothered by it one bit. I do some chiropractic work as well, so I wonder if the farrier is also doing a little bit of minor adjustments to the joints without knowing it, and that's maybe some of the popping that that Christine is her farrier is noticing.
Dr. Mansfield, Linda in California wants to know when a horse might be treated with polysulfated glycosaminoglycan and its potential benefits.
Well, Linda, polysulfated glycosaminoglycan is used to treat degenerative joint disease in horses. It can help decrease that joint inflammation, increase that joint fluid quality and quantity, and help heal that articular cartilage. It's given in a series of intramuscular injections, one dose every 4 days for 7 doses. Just like any disease, the earlier we treat, the better. And there's no age restrictions on Adequan, but I recommend discussing this option with your veterinarian to see if it's the right choice for your horse.
Yeah, just to add to that, I totally agree with you, Dr. Mansfield. And I've used this product often in conjunction with my joint injections. So kind of timing it, if a horse typically gets joints injected every 6 months, kind of timing, adding in the loading dose of these medications, 3 months after injection. So the horse is getting almost year-round joint support care.
Absolutely.
Awesome, thank you. Dr. Ellis, Beth in Pennsylvania asks if it would be appropriate to occasionally give her horse a nonsteroidal anti-inflammatory drug or NSAID for joint pain.
Yeah, that's a really good question. And I'm going to have a really long answer with the beginning statement. It depends. So it depends on the type of NSAID that you're giving, the frequency that you're actually giving it, and the horse's tolerance to that particular medication. NSAIDs can really be helpful to make the horse feel better if they do have joint pain, but we do need to think about the side effects that we can have with them. You know, the biggest we see in horses are definitely gastric ulcers, as well as the potential to cause some kidney issues. Bute and flunixin tend to have more side effects when they're used regularly or frequently over time. Furocoxib, such as Equiox, is safer for horses to stay on long term, but it does tend to improve lameness a little bit less than medications like Bute. So if your horse is severely lame, you're probably going to see less improvement with Furocoxib, but it's going to be safer for horses that maybe have mild lameness for them to stay on over time. So I do have a lot of older horses with OA who I prescribe Furocoxib for. They stay on it for long periods of time to make them comfortable without any issues. I've also had horses that receive Bute once weekly to be ridden who do just fine. And then I've had other patients who show sign of gastric ulcers, such as loss of appetite, loose stool after even a single dose of Bute or even Furocoxib. So it can be very horse specific. So I think you just need to, again, work with your veterinarian and watch your horse closely if you're administering these medications for those signs that maybe they're not tolerating it. If they're tolerating it just fine, occasional use should be pretty safe. One other medication, though, to think about using in addition to NSAIDs or in combination with them is acetaminophen. So I've actually been very surprised and happy with the improvement in lameness that I've seen with using acetaminophen with fewer side effects. And there have been some studies that support that as well. So you can consider adding that into your regimen.
Dr. Mansfield, Lori in North Carolina wants to know if metabolic problems can affect a horse's joint health, and if they can, what kind of changes might you see?
So, while it's often considered an older horse disease, PPID or Cushing's can be diagnosed in horses as young as 7, but typically you're seeing it more around these horses about 20 years old or older. So these older horses are probably going to have some arthritis. Then horses with equine metabolic syndrome tend to be very easy keepers, and overweight animals are definitely predisposed to joint disease. We know that with PPID and equine metabolic syndrome, these horses are predisposed to laminitis, which could also cause them to overweight other limbs and advance their joint problems in other areas. So it's really important to be watchful and make sure you call your vet at the first signs of any issues.
Dr. Ellis, Arlene in Arizona wants to know the best treatment options for horses with OA in the cervical spine.
Yeah, so just like in other regions of the body, horses that have OA in the cervical spine can definitely benefit from injection of those joints. So this procedure is usually done with ultrasound guidance, and we need that ultrasound so that we can actually get our needle to the right location, because those joints aren't easily palpated usually just using your fingers like other joints in the limbs are. But with the ultrasound, we can identify the joint and we can guide our needle to the right location so that we know that we're injecting the joint. Your vet will need to feel comfortable with this procedures, and not all vets are. And you also have to have the proper equipment. So it may depend on what your vet feels comfortable and what kind of tools they have. Other treatments though that I found very helpful is shockwave therapy. This can be really helpful to break the pain cycle. And then I've also utilized other products like bisphosphonates, similar to like Osphos is a bisphosphonate that can help with bone pain, and particularly in older horses with OA in a lot of locations in their neck and otherwise. I've seen some good benefit from that. And then, of course, I think alternative therapies like acupuncture, using pulsed electromagnetic field therapy, chiropractic massage can also be really helpful to keep those horses comfortable.
Dr. Ellis, Tasha in our live audience is asking a follow-up question. She says, after the Adequan loading dose, how often do you give Adequan, and what other dose thereafter?
Yeah, so, and hopefully someone correct me if I'm wrong, but I believe the recommendations now for Adequan are to do the loading dose every 6 months without any dosage in between. So that's changed. You used to do the loading dose and then it was recommended to give it once monthly. You certainly can still administer it that way, but I've had clients do the loading dose every 6 months. And so if the horse is getting injections of their affected joints with OA, every 6 months, basically, then every 3 months, you're doing something to support them. So maybe they're getting joints injected, 3 months later, getting loading dose of Adequan, 3 months later, joint injections, 3 months later, Adequan. And I found that really helpful for horses that have even more advanced OA to keep them comfortable.
I'm just going to piggyback off that. So it's I did the same thing. So I used to do the loading dose and the once a month till I started learning a little more about the science on it. It's actually the series as needed. So you just give that series of 147 as needed. So it's all going to depend on the horse. Some horses may need it once a year. Some may need it twice a year. I had plenty of clients doing it quarterly, especially in those show horses that need a little more joint support. So discuss it with your veterinarian. Twice a year seems to be that kind of happy medium, but doing that series as needed is the way to go.
Awesome. Thank you both. Dr. Mansfield, Carolyn in Kentucky asks if supplements are effective for senior horses with late stage osteoarthritis.
So I'm going to piggyback a little bit of what Dr. Ellis was saying earlier. Supplements are basically used to improve health of the joint and a little bit in the environment, but they're kind of limited in their capabilities for actually treating diagnosed joint disease. They can be used in that multimodal approach, so it's not going to be your only thing for treating joint disease. So, and when you pick supplements, make sure it's a reputable company and they really do have some research behind their products, not just testimonials.
Dr. Ellis, Sue in Indiana wants to know about the pros and cons of using orthobiologics to treat horses with joint disease.
Yeah, I think we could probably have a whole webinar just on orthobiologics, but I'll try to keep my answer fairly brief. So if you're not familiar with the term, orthobiologics involve basically harvesting something from the horse, usually blood, processing that sample to amplify kind of the natural anti-inflammatories or regenerative properties within the horse's blood, and then re-injecting it into the joint. And there's several benefits of using orthobiologics. The first is that it is more quote unquote natural. So it's going to have fewer side effects in the joint as well as for the whole horse if we're comparing them to using steroids in the joint. Certainly in horses that have endocrine disorders such as PPID or equine Cushing's or equine metabolic syndrome, biologics are a much safer choice because we know that steroids can induce laminitis in these horses, which can be both career-ending and sometimes life-threatening in certain cases. The other thing is many biologic products that are out there have growth factors, and those growth factors will not only so you won't only have anti-inflammatory effects, but those growth factors actually promote healing. So you might reduce pain in the joint while also promoting healing if there's any damaged tissue that's present within the joint. And they're very effective at improving the signs of OA. For me, I could think of 3 major cons of biologics compared to steroids. The first is that horses are more likely to have a joint flare following injection. And a joint flare is just the horse's body reacting to what was injected in the joint. What this looks like if it occurs is extreme lameness, swelling, heat in the joint within the first 24 to 48 hours after injection. It usually resolves with just some NSAIDs, rest, and icing pretty quickly, but it can be really scary for the owner to see and have to deal with. The other thing, well, steroids, I should say, can also cause a joint flare, but it does occur less commonly than biologics. The other kind of biologics, probably the biggest one for a lot of owners, is just the cost. Most biologics are going to cost more than using steroids for joint injections. And then the other thing to consider is that most biologics will take a bit longer than steroids to work. So the expectation for improvement in lameness for most biologics is about 2 to 3 weeks after injection. With steroids, we usually see significant improvement within those first 2 weeks typically. And some biologics also do require repeated injections to be effective. So it's important to ask those questions, particularly if you're planning to show your horse about the timing of things if you're going to use those products.
Dr. Ellis, I believe this was your question before. We have a follow-up on the popping sound when the farrier comes from
Yeah.
Lynn in our live audience. So Lynn's farrier has commented that her thoroughbred is acting a little stiff or reluctant to lift one of his hind legs. Should she be concerned about degenerative joint disease in that limb?
Yeah, I think in that scenario, I would be a little bit more concerned that the horse has OA or something else going on that's making him uncomfortable, especially if this is a new behavior for the farrier. We can see horses with hock OA or stifle OA that are resistant to pick up their hind limbs. Horses with pain in their SI or their sacroiliac region can also sometimes be reluctant to pick up their hind limbs. So I would probably have your veterinarian come out and do both a musculoskeletal palpation and a lameness exam so you can identify if there was pain causing this behavior and address it.
Dr. Mansfield, we have another question from Carol in our live audience, and Dr. Ellis, feel free to chime in too if you would like. She would like to know what imaging methods you prefer to use to arrive at an accurate diagnosis of DJD.
Well, I think the first and most important thing is that physical exam, that lameness exam. The hands-on can tell you a lot. And then following that, watching the horse move, flexions, lunging. Then you need nerve blocks because you need to isolate the area to where you suspect the lameness is because you can't start imaging until you know where the problem is. And then radiographs. I mean, radiographs tell us a lot, but these days now we have MRI and CT for things we can't see on radiograph. I've had plenty of horses that their radiographs were beautiful, yet things came up on MRI or CT.
Yeah, I totally agree. It really depends on the horse's degree of lameness as well as what I'm finding on my physical exam. I certainly don't recommend an MRI for every horse, but that would probably give you one of the most complete looks at the joint. Just for cost and often the need for general anesthesia, that's not going to be realistic for most horses. So radiographs are often a good place to start in addition to your physical exam, and then your vet might recommend taking a deeper dive with some more advanced imaging if your horse has a significant lameness or if they're just not finding the answer they expect to find on radiographs.
Dr. Mansfield, Lisa in Michigan asks if feeding horses a diet high in omega-3s could help slow the progression of osteoarthritis as they age.
So omega-3 fatty acids can be beneficial as anti-inflammatories and probably have a decent amount of research behind them. They have been shown to reduce inflammation and support immune function. I mean, we often prescribe them not only for horses with joint disease, but respiratory issues, skin allergies, sometimes even reproductive issues. DHA and EPA are probably the most beneficial forms of omega-3s out there and probably have the most research behind them. So those are the types of omega-3s you should be looking for when adding to your horse's diet. But we really need more research to see how much benefit we can actually expect to see from omega-3s.
Dr. Ellis, Cheryl in Alberta wants to know if a high hind suspensory injury could affect her horse's joint health, and if so, what is his prognosis for a future as a dressage horse?
Yeah, so in the hind limb, the closest joints to the proximal suspensory are the distal hock joints. And proximal hind suspensory issues don't typically affect those joints directly, but certainly there are many horses that have OA in the distal hock joints unrelated to having proximal suspensory disease. So the prognosis for future athletic function for me would really be based more on the severity of the suspensory ligament injury. I think those can be the limiting factor in some horses for returning to athletic use versus having some distal hock OA, which is typically treated fairly easily with injections.
Dr. Mansfield, Elaine in Texas asks if a cold water therapy or icing joints can help reduce inflammation and protect against joint disease.
Therapy can be a valuable tool in managing acute joint disease in horse. It helps to reduce our pain, inflammation, and swelling, especially after exercise or injury. And it does help decrease blood flow to the affected area and slow down that inflammatory process, which ultimately helps to manage pain and inflammation. But it's probably more helpful in acute injuries versus chronic ones.
Yeah, I agree with that. I think the other thing to keep in mind is if you're icing or using cold water therapy, make sure you do that after exercise, not before. If you ice the limb, right, you might decrease the horse's ability to actually feel the joint, and they might not be able to respond appropriately to destabilizing sources like spooking and things like that. So it could damage the joint more. So just make sure you ice after, not before exercise.
Totally agree.
I have a follow-up question to that. Is there a certain length of time that you recommend icing or doing cold water therapy on a joint?
Typically a minimum of 20 to 30 minutes of icing is what's needed to really cool those deeper structures, such as the joint. The cold water therapy isn't quite as effective as actually getting the deeper structures cold as standing in an ice boot. It usually helps with more superficial cooling. And I typically recommend if owners are doing that they do that at least for 10 to 15 minutes. It's going to help probably more with swelling than it is to truly cool the inside of the joint.
Awesome, thank you. Dr. Ellis, Leah in British Columbia wants to know if there are any complementary therapies that could be beneficial for horses with OA.
Yeah, absolutely. And we've already talked about some of them already. I mean, I think the most effective therapy we have for OA is injection and medication directly into the joint. But other alternatives that we can use to keep the horse comfortable are things like shockwave therapy. I mentioned that for the horse's neck, but you can use that in other joints as well. It can be really helpful to break the pain cycle, and it's actually been shown in studies in horses with distal hock OA to significantly improve their lameness after that procedure. I also already mentioned systemic medications like bisphosphonates that can help with horses with bone pain. And then I think we need to think kind of out of the box too. Adding in other things like laser can help with pain and inflammation if you have access to one. PMF is pulsed electromagnetic field therapy. It can also help with bone pain and improve circulation. And then we already talked about acupuncture. I do think acupuncture is a really great add-on treatment to help with pain management, as well as chiropractic care. I use those two mainly with horses with OA and stiffness in the neck, back, and pelvis, but a lot of horses with OA in their limbs will have secondary back pain from their arthritis and them compensating. So I think it can be helpful for a whole body health. As Dr. Mansfield said at the beginning of the talk, though, really a multimodal approach is going to be needed, meaning that you might need different and varied therapies to have the best success.
Dr. Mansfield, Susan in Florida says her 2-year-old sustained an accessory carpus fracture. Is he at a higher risk of developing joint disease? And if so, can she do anything to prevent that?
Well, I think that's kind of going to depend on where the fracture was on the accessory carpal, what type of fracture it was, and what the initial treatment was. I think any fracture is probably more predisposed to developing OA, but it depends on whether it affects the actual joint or any of the surrounding tissues and tendons and ligaments.
Dr. Ellis, we have another question from our live audience, and this listener has an air fern of a draft cross mare. They manage her diet carefully, but she's still round. Is that extra weight possibly contributing to her likelihood of developing DJD?
Yeah, unfortunately, it probably is. We know that the heavier the animal is, the more concussive forces and kind of wear and tear those joints undertake. So we really try to get horses to an appropriate body weight to help decrease just all the sheer force and compression on that joint. It can be really hard. I have an air fern as well as a horse, so I know that keeping weight off of those guys can be really challenging. I think you can work with your vet to try to optimize their diet while they're still getting the nutrients they need, and then exercise. So just continuous low impact exercise is going to be great for these horses to help maintain an appropriate body weight and to keep those joints healthy.
Dr. Ellis, Elise in New York wants to know from the perspective of a veterinarian, what is the hardest part of treating joint disease in horses?
Yeah, so I think the hardest part is a horse that already has really advanced and severe OA. So once those significant changes have happened to the joint, it can't be reversed, and it actually gets harder and harder to get the horses comfortable and break their pain cycle. So my advice is to have your horse evaluated early if lameness is felt or seen. If that initial inflammation within the joint can be treated promptly, you can slow or even prevent advanced OA from happening.
Dr. Mansfield, Susan in Michigan wants to know how she will know when it's time to retire her horse due to OA.
That's a really great question, Susan, and one I used to get a ton in practice. A lot of times our horses are going to tell us when they can't do certain jobs anymore, even if it's just backing off more when riding. But if your horse is sound and happy, work can be good for them. There actually have been some studies even out there that older horses can live longer when they're still getting some work and in shape. Just be sure to keep having those regular exams with your veterinarian, and they're going to be able to cite some of these early problems quicker and hopefully give you some advice.
Dr. Ellis, Robert in Washington wants to know how he can help his horse regain strength and improve joint range of motion.
Yeah, so I could also probably talk about this for a really long time, but there are lots of different tools and exercises out there that can be great to help your horse stay or get stronger and improve their range of motion. There's a lot of physiotherapy exercises. A lot of them, many of you out there already do, such as belly lifts, carrot stretches, those type things. And there's some good resources out there as well to see what those exercises are and what they're targeting, what goals they're accomplishing. There's also different training aids out there that can be used. There's different elastic resistance band training. A couple of them are the Equine system, as well as the Eagle Pro 6 or the Pessoa. All of those aids do is get the horse to engage their core muscles. And so you can incorporate those into your either hand walking or ridden exercise slowly over time to really get those horses to build muscle appropriately, get a really good core strength and top line. You do want to work with your vet when adding in those systems, particularly if your horse has had an injury or has been off work for any period of time, because if you start them too fast, your horse is probably going to get really muscle sore and they might be more painful than when you started. But if incorporated very slowly, they can be really beneficial tools. Then there's also things like balance pads you can get for horses, which work on their core strength and all their really important postural muscles that live next to their spinal column. Balance exercises can help prevent re-injury if they've had an injury in one of their limbs, and also really works on getting that core strength back. And then I think something simple that most horse owners are going to have are poles. So there have been studies that have shown significant activation of core muscle with just walking over ground poles or cavalettis. So you can also add in those things into your riding and you'll be working on your horse's core with minimal effort on your part.
Dr. Mansfield, Judy in Ontario asks if it's a good idea to stop firocoxib during winter when her pony is not in work.
That's a really good question. So the thing about firocoxib is originally not meant to be given for long periods of time, but we do it because our horses need it. I do believe that we should give washout periods and stop it for certain periods of time just to let our horses' systems clear things out. So I think if you're not working and your pony's getting around fine, I think winter is a good time to take a break from it before restarting it. Just remember when you restart, it can take a couple of days to kick back in. So don't give it and expect your horse to feel great the first day. It usually takes 2 to 3 days for it to really be effective again.
Dr. Ellis, Diane in Virginia asks how to reduce a horse's joint pain when they have DSLD. And can you talk a little bit about what DSLD is?
Yeah, absolutely. DSLD stands for degenerative suspensory ligament desmitis. And this is a disease that results in degeneration of the suspensory ligament in all limbs, but usually we see more clinical signs in the hind limbs than the forelimbs. The job of the suspensory is actually to suspend the fetlock joint, hence the name. And so horses that have DSLD will have progressive hyperextension or a dropped appearance to their fetlocks, typically in the hind limbs. What you often see is the horses has fetlock joint pain and effusion, as well as effusion within the tendon sheath. And that's because the changes in their fetlock angle, as well as all those inflammatory mediators at the suspensory branches kind of leak into the adjacent synovial structures, and so they can have some secondary joint inflammation and pain. The other thing to know is the suspensory ligament originates at the top of the cannon bone, and it's right next door to those distal hock joints in the hind limb. So there's a few things you can do to improve horses' comfort level if they have DSLD. The first is to have your farrier put a heel extension on them on their hind feet. And what this does actually changes the biomechanics of their fetlock, and they should drop their fetlocks a bit less, and it'll help support them. The second of these horses, definitely I put on systemic pain medications. I usually use firocoxib on them and acetaminophen because they do typically need to stay on these long term because the disease is progressive over time. The other thing you can do is you can inject their hock joints, their hind fetlocks, and their tendon sheaths. And the reason to inject these joints is, one, it'll make those adjacent joints more comfortable, but what you actually inject into the joints will diffuse out into the surrounding soft tissues, which is in fact the suspensory ligament. So it can make the suspensory ligament feel better too, and might help promote a little bit of healing. In these horses, I always use biologics and I never use steroids. And that's because we know that steroids can actually prevent or worsen ligament injury, so it might make things worse instead of better. Also, if your horse is older, I would have your vet check them for equine Cushing's or PPID. We know that PPID results in increased circulating steroid levels in the horse's body, and that will also weaken the horse's tendon and ligaments as well.
Dr. Mansfield, Helen in California wants to know if there is any current treatment available that can stop the progression of joint disease.
Unfortunately, Helen, there's no drug out there that can completely stop the progression of joint disease. I wish there was, because I could probably use it myself. There are medications out there that can definitely slow it down. Polysulfate glycosaminoglycan or Adequan and hyaluronic acid or Legend have been shown to have some disease modifying effects on joint disease. And if you know of particular joints that are having issues, some of our intra-articular orthobiologics can really help.
Dr. Ellis, Catherine in our live audience would like to know how important is proper conditioning, warm-up, and cool-down for maintaining joint health.
Yeah, well, I think it's important not just for joint health, but for the whole horse's body. Certainly in horses that have OA, one of the things that you might notice as the owner and will report to your vet is that the horse seems very stiff at the beginning of the ride, and then they warm up out of or that stiffness. That's typically what happens with OA. So that warm up is really important to get the joints mobile. You can think about the same way as yourself. When you get out of bed in the morning, you're probably pretty stiff. Once you move around, everything gets a little bit looser and warmed up and you feel a lot better. In addition to the joints though, that warm up is also super important for all of the tendons and ligaments and the soft tissues in the horse's body. So similarly, those tendons and ligaments are usually really stiff if the horse has been standing in a stall or not exercising, and they actually become more stretchy and elastic over time. So I typically recommend at least a 10 to 15 minute good walking warm up, maybe longer if you live in a really cold environment and it's winter time, maybe slightly less if you live in, like me, Georgia in summer. Those horses warm up pretty quickly because it's quite hot. Doing your exercise and then also cooling them down. I think similarly, less for their joints and probably more for the rest of their body. That cool down so that they can return to normal is really important for their overall health and well-being.
Dr. Mansfield, John from our live audience would like to know if DJD can be hereditary and should breeders be concerned about passing it on?
I think there's definitely some cases where it can be hereditary, especially when you're dealing with conformational issues. When your horse isn't built right, they're going to have added stress on joints. OCDs are definitely have genetic factors that are passed down. It's definitely something to have talked with your veterinarian about and looking at your horse overall, the overall picture of your horse, how they're standing, how their feet look, where they can make improvements, especially in chewing, because just fixing some of the feet can help a lot of their balance issues.
Dr. Ellis, Julia in Texas asks how veterinarians diagnose joint disease and joints that are not in the limbs.
Yeah, so if a horse has OA in the joints in their neck or their back, we can still do radiographs or ultrasound of these areas to see if there are bony changes. For the neck and the back, radiographs, if you're having your horse evaluated in the field, can be a little bit tricky with a portable x-ray machine if the horse is really big, because we can only increase our settings for that machine so high and then we're kind of maxed out. So it may be hard for us to get a good quality image. Your vet might recommend, and then if they're worried about OA in your horse's neck or back, that you take your horse to a referral hospital where they have a much more powerful x-ray machine. A lot of what we do can be looked at in the field though, and certainly your exam is going to maybe clue you in if the horse does have stiffness or pain on palpation on certain regions of their neck or back. We might be highly suspicious, and then we can follow up with radiographs and ultrasound to see how severe that OA is.
Dr. Ellis, Julie from our live audience says that her horse's hock is fusing. She was thinking about trying a bisphosphonate and is wondering if that would help. But first, could you describe what it means for a hock to fuse and how common it is?
Yeah, absolutely. So when we think about the hock joint, the horse's hock actually is made up of 4 joints. And the bottom 2 joints, known as the tarsometatarsal and distal intertarsal joints, are the ones where horses most commonly get osteoarthritis. The convenient part about that is those joints are low motion joints, so they undergo a lot of shear stress, but they don't have a huge range of motion. So it means the horse can fuse those joints completely, and it actually doesn't affect the horse's athletic ability or their range of motion within their hocks. So if they're gonna try to fuse a joint, that's a decent one to pick. So when that fusion occurs, it can be a little bit tricky. What we're actually trying to do over time is get those joints to fuse completely, because again, that takes away the pain. When the horse is kind of in the middle where they have a lot of bony changes, that joint is trying to fuse, but it's not completely fused, they still have enough motion that they can be painful. And those horses can be a little bit harder to treat because there's not a huge space into which to inject medications. So there's some thoughts. Bisphosphonates have a variety of roles. If we think about them from a human medicine standpoint, bisphosphonates are supposed to stop kind of osseous remodeling. The drugs that we use, the bisphosphonates in veterinary medicine, usually are not as potent, so probably don't have as strong effects. So I guess there's one school of thought where you might say you're wanting the horse's joints to fuse, a bisphosphonates might possibly delay that fusion process. The other side of things is if you really need to help with bone pain, bisphosphonates are a good option. So those are the conversations I usually have with my clients if joint fusion is happening in their distal hock joints. I have had really some horses that respond really well to bisphosphonates, others that they've been minimally effective depending on how severe that hock fusion is. And fusion of the distal hock joints is not super uncommon. We certainly see it in older horses over time, but we can also see it in young horses, particularly if they were premature when they're born. That the shape of their distal hock joint bones is actually malformed in some of those horses. It changes how that joint biomechanically is loaded, and it results in what we call juvenile OA.
Dr. Mansfield, Jesse from our live audience wants to know, how does turnout versus stall rest impact horses with DJD?
That's a great question. So I've always felt that motion is lotion. So I feel like a lot of horses that move more, I know, heck, with my achy joints, I do better when I'm moving. So I feel like these horses, letting them get moving actually helps the joints a lot, helps move nutrients in, helps move waste out, down to the cellular level. Standing around can make them a bit stiffer, and they're horses. They need to get out and move.
Yeah, I totally agree. I think actually locking a horse with osteoarthritis in a stall will make them way worse. And if they can get out and move, they often seem way more comfortable.
Dr. Ellis, Kara, who is also in our live audience, is curious, does hoof balance and farrier work play a role in joint health?
Yeah, I think absolutely. There's that saying, no foot, no horse. And I think everything starts from the ground up. So I think Dr. Mansfield alluded to this earlier, but if the horse has a really unbalanced foot, it's going to stress all of the joints up the limb, and even up into the horse's axial skeleton in different ways. So if they don't have a good balanced foot, it can really affect all of the joints above them. So working with your farrier to try to get them balanced as much as possible and comfortable will help potentially prevent or improve clinical signs if they do have OA.
Dr. Mansfield, Alice in Michigan wants to know if it could be beneficial for her to put a currently sound 18-year-old horse on a joint supplement as a preventative measure, even in his senior years.
I think that's probably the best use of supplements, trying to bring some added nutrients to the joints. But there's no research out there that says any supplement or even drug for that matter is a preventative, mainly because it's hard to guess which horses are going to develop joint disease and when. And I know I've already stated this, when you're picking these supplements, make sure you're picking a reputable company that has good research on their products, or even just talk to your veterinarian about what they recommend and have had success with.
Dr. Ellis, Kay from our live audience would like for you to talk a little bit more about acetaminophen dosages for horses with OA. Are there side effects, and how can they be used in combination with other drugs?
Yeah, good question. So there are a couple studies out there that looked at what is the dosage in horses. There have been some short-term safety studies. To my knowledge, there haven't been really long-term, meaning horses that have been on it for years, safety studies. But typically the dosage, you'll want to work with your veterinarian. I won't make you do math tonight, but it's anywhere from 20 to 30 milligrams per kilogram. What that equates to is if you get the maximum strength acetaminophen, which are 500 milligram tablets, you are looking to give an average size horse about 20 of those suckers about twice a day. In my experience with clients, shockingly, the horses actually eat them quite well in their grain, so they must not taste too bad, and it can really be helpful. The downside is you're buying a lot of acetaminophen because you'll go through that pretty quickly with that quantity. I have used it instead of NSAIDs in horses that could not tolerate it, or I've used it in combination with NSAIDs in horses that were really, really painful. The side effects, we don't really know long term. In people, right, we worry about liver changes in horses with acetaminophen, at least in short-term studies that we've done in horses, that doesn't seem to be an issue for them. So I've had several horses that I've had to keep on acetaminophen for weeks to months due to severe lameness issues and pain, and they've done really well on that medication. So I think it's something to consider.
Dr. Mansfield, Deborah in Massachusetts asks if injecting a horse's joints every 4 to 6 months is an appropriate maintenance or prevention program for joint health.
Well, I think that really depends on the horse. I'm a firm believer in injecting joints when needed versus on a timeline. Now, some horses really do need injecting every 6 months to keep their joints happy, but every time we enter those joints, we always have risks. But that's where us vets rely on y'all to let us know when your horse is starting to show signs of discomfort. Having your vet perform these regular soundness exams could really help figure out when your horse needs injecting versus being on a timeline.
I totally agree. I really try not to use a calendar to inject the horses. I let the horse tell me. So I work with the owner to try to identify what are really, really early signs that your horse might be having some joint pain and might need a little bit more help. Or we need to schedule regular performance evaluations to see if we're picking up subtle signs for that horse that warrants injecting at that time.
Dr. Ellis, Margaret in Ohio wants to know if a severe laceration around a horse's joint could make them more likely to develop joint disease later in life.
Yeah, it could if there were a couple of scenarios that happened. The first would be severe lacerations if they enter the joint and the joint gets infected. Certainly that horse is at much higher risk of developing OA, particularly if the infection is not resolved quickly. So that's probably the most common way that lacerations will cause OA in a horse. The other way that it could cause OA is if the laceration actually damages the supporting soft tissues outside of the joint. So some of the ligaments are helping stabilize that joint and they are lacerated at the same time, it can leave the joint unstable, which might result in more inflammation with the joint and development of OA, again, if that joint is not then appropriately stabilized and treated.
Dr. Mansfield, Jackie in British Columbia wants to know the best course of action for a senior semi-retired horse that sometimes struggles to get up after laying down.
Well, first off, Jackie, I completely feel your horse's pain. The older I get, the same issues I have. But I think the first thing you need to do is get a really good, thorough exam by your veterinarian to try and determine the main source of pain. This could, I mean, is it muscular? Is it joint related? Or is it even a little neurologic related? It's all going to depend on what this is to the course of treatment. And once you figure out what's going on, then you can work out a treatment plan with your vet, whether it be anti-inflammatories, supplements, or systemic treatments.
Dr. Ellis, Carol in Florida wants to know the prognosis for a 5-year-old whose hocks are already starting to fuse. Is there anything that could be done to slow this and maintain the horse's long-term soundness?
Yeah, so I think we talked about this a little bit with one of the questions from the audience already, but interestingly, if the distal hock joints are already starting to fuse, I actually would want to speed up the fusion rather than slow it down. We know that it's going to happen over time, and like I said earlier, the distal hock joints are joints that if they fuse completely, then the horse's pain goes away. So sometimes I'm actually trying to do things to promote fusion rather than to slow it down to try to get that horse as comfortable as quickly as possible. Now, the fusion process can be really variable, how long it takes from horse to horse, so it's not really predictable. But you can do things like injecting steroids into the joints, which can actually promote more joint fusion. There are also surgical procedures that can be done that purposefully fuse those joints, so then the horse can get back to athletic use a lot sooner than if you let it occur naturally. So those are some things to consider, and probably the way that I would go in this horse so that you could have an athletic horse longer in his lifetime.
Dr. Mansfield, Mary in Illinois asks how veterinarians treat and manage horses with ring bone.
Can be a tricky one. There are two types of ring bone. We have high ring bone and low ring bone. High ring bone affects the pastern joint and low ring bone the coffin joint. High ring bone I found tends to be a little bit more manageable than low ring bone. Depending on the location, severity, some treatment options are going to be weight management, therapeutic shoeing, joint injections, NSAIDs, sometimes even surgery to fuse that joint, like Dr. Ellis was talking about. But it's probably going to take a combination of therapies to find that right treatment plan for your horse.
Dr. Ellis, Brandon, Ohio wants to know how to keep a horse fit and active without accelerating joint degeneration.
Yeah, that's a really good question. So I think the key is to incorporate low impact exercise. And so that could mean having lighter work days, mainly at a good working walk rather than doing more intensive exercise every single day. Certainly too, for the horse's whole body, if you can exercise them on different surfaces, we call that cross training in people, but we can do it in horses too. You're going to load different structures. So softer footing, maybe you're going to have less impact on the joints, but you're going to load the tendons and ligaments a little bit more than if you exercise on a firmer footing. You might load the joints a little bit more, but you kind of give the tendons and ligaments a break. So it's good to kind of mix that up so you prepare the horse's body and don't overstress one particular part of their musculoskeletal system. I talked about some training aids that can be used, such as those elastic resistance bands. I think that they can be really helpful in horses to work and maintain fitness and core strength, even at slower gaits. So they can be effective at the walk. You can use them at faster gaits as well, but they can be helpful if you're just having a nice, easy walk day to still get your horse to use their body correctly. And then there are tons of physiotherapy exercises out there that promote core strength and flexibility and then have little impact on the joint. So I think it's great to incorporate those if you can. They're pretty easy and fast to perform. They don't cost you anything except a little bit of time. And most horses feel really good when they're doing those regularly. I think if you're lucky enough to have access to one, underwater treadmill exercise is fantastic for promoting core strength and fitness. And the water provides some buoyancy, which is easier on the joints. So if you have access to one, not many people do, but it's a great tool for low impact exercise that really still works on fitness and conditioning.
Dr. Mansfield, Nancy says her 4-year-old mare has an OCD lesion. How do veterinarians treat OCDs and what is the prognosis?
So osteochondritis dissecans, or OCD, is a developmental orthopedic disease that affects the joints usually of young horses. It occurs when that portion of that cartilage and underlying bone or subchondral bone separates from that main bone. The exact cause is unknown, but it's usually believed to be related to rapid growth during early development, some nutritional factors, and even a genetic predisposition. The lesions can vary in severity, and some horses don't show any symptoms, while others can show symptoms like lameness, joint swelling, stiffness, pain. The treatment for OCD depends on the severity of the lesion and the horse's age. Conservative treatment can sometimes work, rest, anti-inflammatory medications, and physical therapy, but that's really usually just for very mild lesions. But I find most horses really need surgery to remove that loose cartilage and the bone fragments. The type of surgery is going to depend on the location and the size of the lesion. Now, the prognosis for horses with OCD depends again on that severity of the lesion and the treatment we received. But the prognosis for athletic function is usually pretty good for most OCDs that are treated surgically. Although some OCD locations like the shoulder may have reduced prognosis. But in general, if the OCD lesion is not removed, the prognosis for future soundness will definitely be decreased.
Dr. Ellis, Becky in Washington wants to know if any breeds are more prone to developing OA than others.
To my knowledge, there are not any specific breeds. I certainly diagnose horses with OA that are a variety of breeds: warmbloods, thoroughbreds, quarter horses, Spanish horses, etc. I think it's so common that there probably is a genetic predisposition, but we see it across all horses and all disciplines. I'd say the one type breed that we see it less in is ponies, and that's probably because their smaller size is easier on their joints. And we will tend to see more OA in horses that have worked very intensely at a young age, so while they're still growing. So certainly thoroughbred race horses can have a bit more OA. Futurity horses tend to develop OA a bit sooner. And then we already talked about that there can be some juvenile forms of OA that can occur in horses that were born premature. So I think there's just so many factors that are in play. It's hard to suss out if there's one genetic breed predisposition or not.
And Dr. Ellis, I have a follow-up question to that, and it'll probably be our last question of the night. Are there any disciplines that are more prone to developing joint disease?
Gosh, it doesn't really seem like it, unfortunately. It seems like I work on a variety of disciplines, eventers, barrel racers, all kinds of levels, and it seems like OA is probably one of the most common things we diagnose. I think those joints just require so much use to really do any kind of athletic job that that wear and tear that the joint goes through. Unfortunately, most horses, if they're doing any kind of athletic work, are probably going to develop OA at some point in their life.
Well, that's all the time we have for tonight. We've covered quite a lot, and I hope our listeners have learned as much as I have. Thank you, Drs. Ellis and Mansfield, for joining me.
Thank you so much.
Thanks, Haley.
And thank you to American Regent Animal Health for sponsoring this event. And finally, thank you to our audience for listening and sending in all of these questions. If you're listening to us live after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.